Hello and welcome to Homeopathy Simply Explained. I am Petra Merker, an alternative practitioner for classical homeopathy in Darmstadt, and in today's video we have the seminar on the topic of pandemic, again in today's part 6, suspected Post Vac cases. In the homeopathic practice we know our patients very well through detailed case studies and know what weak points each patient has in their psyche, but also in their body. With the introduction of the vaccination, long-standing patients often come to the practice with completely new unfamiliar complaints. Also new patients with complaints that they did not know before, which I as a practitioner have already seen in a similar form in other patients in connection with the vaccination. Today we talk again about such suspected cases on Post Vac. In the last part of the seminar about Post Vac, we discussed cases that you have already seen in another video without drug descriptions. Today we are discussing new cases with different complaints. First, let's take a look at the overview of what awaits you in today's seminar part. First of all, let's look at the side effects of heavy menstrual bleeding and an associated case study. This is followed by the side effect of facial swelling with a corresponding case that also showed pathogen reactivation. We will briefly discuss the side effect of autoimmune hepatitis and the side effect of shingles before moving on to a case of salivary gland inflammation. If you would like to support my work, you can find my PayPal account linked under the video. Now I wish you a lot of fun with today's part of the seminar. We come to a case with symptoms that the EMA has also recognized as a possible vaccination side effect. On October 28, 2022, ZDF headline EMA about BioNTech and Moderna's strong period as a possible vaccination side effect. It was said that the symptoms were mostly temporary. I would now like to introduce you to a case so that you can get an idea of its problem. My patient had had severe bleeding for over a year. The patient was 42 years old at the time of anamnesis and has been under my treatment for a long time. She was given Moderna on April 8, 2021 and BioNTech on December 11, 2021, after which the bleeding symptoms began and were still causing symptoms until the anamnesis on January 16, 2023, a year later. The patient has a 25 to 27 day cycle. Spotting begins 3 or 4 days before menstruation. Then there is a break of 1 or 2 days, after which menstruation begins. On the second day of the menses, there is a light, liquid membranous bleeding that looks like small pieces of liver. The bleeding is so heavy that it feels like the tampon is being pushed out every 2 minutes. As a result, the patient can no longer leave the house. This bleeding lasts 3 or 4 days. The patient is very weak from menstruation and becomes shaky. The legs are swollen in the morning. Since the beginning of 2022, she has also felt a stinging sensation in her ovaries during her cycle, and an ultrasound revealed that the ovaries are quite small. Let's look at the repertorization from January 16, 2023. I have taken the categories mens membranous profuse, thin lumps with intermittent and stabbing ovarian pain. Ustilago covers all symptoms. Ustilagomydes is a fungus that causes corn blight. Like Cecale-cornutum, the ergot Ustilago also contains ergotamine-like alkaloids. The fungus can cause allergies and was previously used for abortion. Diarrhea and skin changes have been observed in children and mice. Neurotoxicity and organ changes have occurred in rats. In the homeopathic medicine picture, we find a hypertrophied, collapsed, or atonic uterus. The cervix is sensitive and spongy. The blood clumps together and clots heavily. The ovarian vascular system is attacked and congestion occurs with dark oozing bleeding. Menstruation is profuse, bright red and slowly clotting. In Ustilago, we are dealing with active, copious, continuous bleeding that is accompanied by clots. The clots are dark and there are pouring of bright red blood. So I prescribe the patient Ustilago C30 once a day and 4 times a day before menstruation. On January 25, 2023, menstruation began with fresh, bright red blood. It contained small chunks of tissue that at 1.5 to 2 centimeters were significantly smaller than before. During her last period, she had to change the tampon every 30 minutes, but that was no longer the case. On January 30, 2023, another slightly larger piece of tissue separated, but the bleeding was light. From February 24th to February 27th, 2023, menstruation was normal. On March 26th, 2023, the patient had to change the tampon frequently again and there were large tissue losses. I changed the potency so that the patient took Ustilago C200 once a week from April 12, 2023 and once a day before menstruation. On April 24, 2023, menstruation went smoothly. On May 23, 2023, heavy bleeding occurred again on the 3rd day of menstruation, but it got better 5 hours after taking Ustilago C200. From August 15th to August 19th, 2023, the month before that, menstruation went without any problems. Patient rated the symptoms as half better than before the homeopathic treatment, but there were still pieces of tissue present. On December 11th, 2023, after menstruation no longer causes any problems, the patient now had to change the tampon every 15 minutes again and the blood flowed down her legs. Since there was no higher potency available, I went back to the C30, which improved quickly and instructed the patient to keep a higher potency on hand. By July 23, 2024, menstruation no longer causes any problems. On July 23, 2024, the patient sent me this video while on vacation. I instructed her again what to do, but then heard nothing from the patient since then. Of course, the patient also went for a gynecological examination in between, but nothing was found apart from the small ovaries. From the graphic, we can see that the distance between the very heavy bleeding have increased. I don't know how long this will continue, and I hope for the patient's sake that the symptoms continue to become less and less. Next case involves a patient with facial swelling. The EMA found that this vaccination complication occurs in patients who have had hyaluronic acid injections. However, my patient and another patient with these symptoms had any hyaluronic treatments in the past. The patient had the third vaccination with BioNTech in February 2022. At the beginning of August, the patient developed a sun allergy while on vacation, which she had never had in previous years. Small puffs appeared on the face that burned and small blisters with a light-colored liquid that itched. In September 2022, the face suddenly started to glow and the skin on the neck also felt irritated. The skin was swollen, itchy, red, hot, itchy, tight, and felt numb and leathery. The patient took antihistamines, which only helped for a short time. She dabbed her face with cold water, which felt good. Skin was very dry. Here we now see a laboratory test from October 25th, 2022 with the reactivation of the Borrelia and the Helicobacter pylori germ. Such reactivations of dormant pathogens can also typically occur after corona vaccination. The patient also had autoimmune disease and liver strain. It was known relatively early on that the liver could be damaged by the mRNA vaccination, but it was repeatedly disputed. This is what the Pharmazeutische Zeitung headlined on April 8, 2022. EMA report no autoimmune hepatitis after the mRNA vaccination. The European Medicines Agency has examined individual cases of autoimmune hepatitis in connection with the mRNA-based COVID-19 vaccines from BioNTech, Pfizer and Moderna. A causal connection cannot be proven, the authority said. However, the Swiss continued to address this issue and conducted research into it. On August 28, 2023, the University Hospital of Basel headlined "Very Rare and Better Understood Liver Damage After COVID-19 Vaccination." Very rare cases, vaccinations can cause liver damage. This applies to the flu vaccination, but also to the COVID-19 vaccination. However, little is known about the mechanism of liver damage. A study by researchers at the University Hospital of Basel now shows that there are similarities but also clear differences to autoimmune hepatitis, a well-known autoimmune diseases of the liver. In contrast to autoimmune hepatitis, patients also have a good chance of fully recovering from liver damage caused by the COVID-19 vaccination. End of quote. Due to the misdirected immune system, persistent diseases can no longer be kept in check in some vaccinated patients. This was first noticed regarding shingles. In September 2022, the Frankfurter Rundschau headlined "Side effects after corona vaccination, increased risk of shingles." BioNTech, which produced the corona vaccination in Germany, is also developing an mRNA vaccine against shingles. A vaccination for the side effect of the vaccination, so to speak. My practice, however, as seen in this patient, I also see other pathogens that suddenly can no longer be controlled by the immune system. But let's get back to the facial swelling and repertorization. We have the following categories: skin swelling, heat fever without, tingling, hardness, lumps, and eye swelling eyelids. Here we see a total of 5 homeopathic medicines that all have symptoms. Let's take a closer look at Apis and Rhus-Tox. Conventional medicine is also coming up with the idea of using bee venom therapeutically. This is the headline from Goethe University on December 20, 2022. Pharma research, mild bee venom shows greater application potential. Quote, end of quote. Let's take a closer look at the ingredients of bee venom. There we have the largest component of bee venom, melittin. This is a cell poison that makes the cell membranes permeable to the potassium ions, and mast cell degeneration and vasodilatation occurs. Another component of bee venom is phospholipase A, an enzyme that catalyzes the hydrolytic cleavage of phospholipids and thus attacks cell membranes. Apamine is a neurotoxin. Hyaluronidase expands the blood vessels, causes them to become permeable, and causes an inflammatory reaction. Then there are two neuropeptides in bee venom. One is the mast cell degranulating peptide, on the other hand the terpene. As far as is known, secamine has no noteworthy effect on the organism. Other components of bee venom include histamine, dopamine, norepinephrine, and alarm pheromones. In the homeopathic medical picture of Apis mellifica, we find the effect on the cell tissue, which is particularly noticeable in the formation of edema in the skin and mucous membranes. They are serous inflammations with exudation and stabbing pain. Apis patients have aggravation from heat, touch, and pressure. Rhus toxicodendron, or oak-leaved poison sumac, contains the active ingredient urogel, which inhibits tissue hormone production. Tissue hormones have an inflammatory or anti-inflammatory effect and reduce or increase blood clotting. Tissue hormones receptors are among the G-protein coupled membrane receptors against which autoimmunity is often present in post-COVID, Post Vac, and ME/CFS patients. Another active ingredient of Rhus toxicodendron is fisetin. Fisetin has a genetic altering effect and reduces the toxicity of mold. In mice, fisetin delayed disease symptoms and thus led to a longer lifespan. Other active ingredients include gallic acid, rustanic acid, and toxicodendrol. Ingested plant parts lead to inflammation of the gastrointestinal tract with vomiting and colic. There is also blood in the urine and neurological symptoms that are similar to atropine poisoning. The plant can also cause inflammation of the mucous membranes and skin blisters. In the homeopathic medical picture of Rhus toxicodendron, we find septic conditions, inflammation of the connective tissue, infections, facial swelling, urticaria, and severe itching. The patient took Rhus Tox XM for the first time on November 25, 2022. The previously prescribed Apis always only brought temporary improvement. With Rhus Tox, the redness, itching, and feeling of heat quickly improved. On December 16, 2022, the face only felt slightly numb, and on January 27, 2023, it was just as smooth as if it had been sunburned. The patient decided on antibiotic therapy for the Borrelia and Helicobacter activation. The patient took doxycycline for 3 weeks for the Borrelia, and for the Helicobacter 4 times 3 tablets of another antibiotic. The patient became depressed, had less sense of taste, was no longer hungry, had stomach pain that felt sore and scraped, diarrhea and flatulence. I prescribed the patient Okubaka D3 3 times 1 tablets for 3 weeks and a preparation for the microbial build-up of the intestine. Okubaka is a sandalwood plant and has been used in Africa for a long time. This remedy came to Europe through a West African who gave his homeopath some tree bark as a thank you for the successful treatment. The homeopath Dr. Kunst from Frankfurt had a homeopathic medicine made from it, which can be used for various food poisoning. Okubaka primarily has an effect on the gastrointestinal tract. It strengthens the bile, liver, pancreas, and immune system. It is used for poisoning, infections, or histamine intolerance. I also use Okubaka after antibiotic therapy or chemotherapy. I will make a separate video about Okubaka. Low potencies such as D3 are used. Next case involves an inflammation of the salivary glands that occurred after the COVID vaccination. The patient received Moderna on June 26, 2021 and August 7, 2021 and BioNTech on January 12, 2022. The patient tolerated the first 2 vaccinations poorly. She developed chills, vomiting, diarrhea, and slumped over. After 24 hours, she felt better again. Her menstruation only reappeared in November in the form of breakthrough bleeding. 3 to 4 days after the 3rd vaccination, facial pain, eyelid inflammation, and conjunctivitis occurred. In the morning, her eyes were sticky on both sides with yellow pus, and the patient has stabbing pain in her eyes when she applied cream to her lips. She also woke up at night with cramps in her feet. The facial pain feels like someone is pulling her face down, like a cramp. After taking aclicovir, she was able to sag her shoulders again and her face improved, but the veins were still cramping. It was tiring to keep her eyes open and frowning much harder. The lip problems started on December 21st. The patient woke up in the morning with prickly, puffy lips. The skin around the lips and chin was red. The skin on the lips peels off every day and the eyelashes also flake off every day. 2 to 4 weeks after the 3rd vaccination, the mucous membranes on the mouth and nose dried out so much that the patient could no longer swallow anything dry. She had a pulling pain in her salivary gland like when she eat extremely acidic foods. The most serious and prominent symptom was the dryness of the mucous membranes, which caused difficulty swallowing. In order to rule out Sjogren's syndrome, I sent the patient to the laboratory, which could not detect any autoimmune disease. Here we see the repertorization: mouth dryness, face inflammation, parotid, mouth saliva spars, pain, face pain, parotid, general food at the aggravation, general food, dry food aggravation, nose dryness inside, general mucous membranes, complaints of dryness. When consumed, the berries of bryonia, also known as bryony, cause gastrointestinal disorders, delirium, convulsion, and in the worst case, death from respiratory paralysis. In case of skin contact, allergic, inflammatory skin reactions can occur. Bryonia has a laxative, blood sugar lowering, anti-tumor, cell damaging and immune stimulating effect. In the homeopathic medicine picture, we find the effect on serous membranes, the nerves, the muscles and the mucous membranes which become dry. Bryonia damages the capillary by attacking the epithelial surface. The dead cells lead to coagulation of serum fibrin. The patient was given Bryonia D200, after which saliva returned after a week and the facial pain disappeared. Unfortunately, the patient is no longer under my treatment, so I can't say anything about the further course. I hope you got added value from the video. If you like it, I would be happy to receive a thumb up. Subscribe to the channel and don't forget to activate the bell. Until then, goodbye.